Did you know that most seniors who develop heart failure never notice the first signs until it's already advanced? It's not always about sudden chest pain or collapse. In fact, heart failure usually begins quietly, with subtle symptoms that most people dismiss as just getting older. But these small changes in breathing, swelling, energy, or even sleep are your body's early warning that the heart is struggling to keep up. Here's what's even more alarming. Studies show that nearly half of all older adults with early heart failure don't know they have it. The symptoms build slowly, and by the time shortness of breath or fatigue becomes obvious, the heart has already weakened. Ignoring these early signs doesn't just lead to discomfort. It can double your risk of hospitalization and make recovery much harder. The good news is that the body always gives clues. You just need to know what to look for. When detected early, heart failure can often be managed, and many seniors can live active, independent lives for years. But to do that, you must recognize the warning signs before they turn into emergencies. In this video, we'll go through 10 early heart failure signs that seniors should never ignore. These are not rare or extreme. They're everyday signals that your heart may be under pressure. Some of them might surprise you, like one that often appears in your sleep, and another that shows up in your legs long before any chest pain. Before we begin, let's make this personal. Have you or someone you know been feeling more tired lately, out of breath, or noticed swelling in the ankles or feet? And if so, how long has it been happening? Share your experience in the comments. We'll be discussing how to spot these early signs and what to do about them. Now let's begin with number one. Number one, shortness of breath or trouble breathing. Shortness of breath is the single most common early sign seniors notice when the heart starts to struggle. At first, it may show up only during exertion, climbing a flight of stairs, carrying groceries, or walking across a parking lot. Over weeks to months, the same level of effort that used to feel easy becomes uncomfortable. That change is not normal for a stable routine. In heart failure, the heart can no longer pump efficiently. Blood backs up into the vessels that feed the lungs and into lung tissue itself. That produces a feeling of tightness, increased effort to breathe, and a tendency to stop and rest more often. Pay attention to shifts in activity tolerance. If someone who used to walk half a mile without stopping now needs to pause after a few blocks, that decline matters. Likewise, trouble breathing when lying flat, needing an extra pillow, or propping the upper body up to sleep is a classic early red flag. Waking up suddenly gasping for air at night and sitting up to catch your breath is not normal. These are signs that fluid is moving into the lungs when the body is horizontal. Another related pattern is progressive shortness of breath. It begins with vigorous activity, then appears with mild activity, and eventually occurs at rest. That steady slide should prompt immediate evaluation. Older adults sometimes downplay breathlessness. They may blame it on age, being out of shape, or lung problems. That makes it easy for early heart failure to be missed. Family members and caregivers should notice changes in daily patterns, slower walking, pauses while climbing stairs, or avoiding previously normal activities. If those shifts happen over a few weeks or months, don't ignore them. Breathlessness can also be mistaken for lung disease. Tests like chest x-rays, blood tests, and an echocardiogram, heart ultrasound, help separate lung problems from heart failure. One practical everyday check is activity-based. If walking the same distance used to feel easy and now causes noticeable breathlessness, treat it as a signal to see a clinician. For people with existing heart or lung disease, any sudden increase in shortness of breath is a reason to contact a health provider right away. In older adults, shortness of breath may not sound dramatic in words. It might show as exhaustion after light chores, needing to rest multiple times during a walk, or sleeping propped up. Those small changes are important. Track them and report them. Healthcare teams treat earlier when symptoms are recognized early, and patients do better when treatment starts before severe fluid buildup occurs. Official guidance lists shortness of breath and needing extra pillows when sleeping as key symptoms to watch. Number 2, unexplained swelling, especially in the legs, ankles, or belly. Swelling that appears without an obvious reason, such as recent injury, long plane rides, or new medications, is another early sign seniors should not ignore. In heart failure, the failing heart cannot move blood forward effectively. That causes blood to back up in the veins and pushes fluid out of the blood vessels and into surrounding tissues. The most common places for that fluid to collect are the ankles, lower legs, and the abdomen. A small increase might be barely visible at first, but a steady progression, tighter shoes in the evening, socks leaving deeper marks, or a visible increase in leg size is meaningful. Keep a simple record, weigh yourself daily, and note any rapid gains. A sudden gain of about 5 pounds, around 2.3 kilograms, over a few days, often signals fluid retention and needs prompt attention. Rapid weight gain, worsening ankle swelling, and increasing abdominal tightness together point toward fluid buildup from the heart not keeping up. If swelling is limited to one leg, it might mean a blocked vein rather than heart failure. Swelling in both legs, especially accompanied by weight gain and shortness of breath, points toward a cardiac cause. Medications and other conditions can also cause swelling. Blood pressure drugs, certain diabetes medicines, or decreased kidney function may lead to fluid retention. Still, unexplained swelling in older adults, particularly when linked to reduced activity tolerance or shortness of breath, should trigger a medical check. An exam and tests can measure how much fluid is present, evaluate kidney and liver function, and image the heart. In many cases, simple steps, salt restriction, adjusting medications, and starting appropriate heart medicines reduce fluid and relieve symptoms, but those decisions should be made by a clinician after assessment. Watch for related signs, tightness in clothes, a visibly swollen belly, or needing to prop feet up because they feel heavy. When swelling and shortness of breath appear together, act quickly. That combination can progress fast and lead to emergency situations. Clinical guides identify swelling with weight gain as a key symptom to track for worsening heart failure. Number 3, unusual fatigue, low energy, or persistent weakness. Fatigue that doesn't match the level of activity is a subtle but frequent early sign in older adults. People may write off increased tiredness as just getting older, retirement effects, or poor sleep. That mindset delays diagnosis. In heart failure, the body's tissues receive less oxygen and fewer nutrients because of reduced blood flow. Muscles tire faster, daily tasks feel harder, and older adults may become less active as a result. That drop in activity then causes more weakness, a cycle that hides the underlying problem. Look for changes in daily routine, needing to nap more often than before, stopping chores halfway through, avoiding social outings because of lack of energy, or losing interest in activities that used to be pleasant. When fatigue is accompanied by shortness of breath, swelling, or sudden weight changes, it becomes far more concerning. There are many causes of fatigue in seniors: thyroid problems, low blood counts, depression, poor sleep, infections, or medication side effects. But new or worsening fatigue that reduces activity level deserves an evaluation that includes heart function. Tests can identify whether the heart is contributing to shortness of breath or weakness. In cases where heart failure is the cause, specific medications and lifestyle changes often improve energy within weeks. Don't accept unexplained progressive fatigue as normal aging. Track how much the person's daily activity has dropped and how quickly. If a shift happens over weeks to a few months, ask for a heart check. Early treatment can reverse fatigue caused by reduced heart function and restore the ability to do daily tasks. Number 4, persistent cough or wheeze, sometimes producing frothy sputum. A long-standing cough or wheeze can be a sign of heart-related fluid in the lungs. In heart failure, fluid can leak into lung tissue and airway spaces, producing a dry cough or a cough with white or pink frothy mucus. Patients and caregivers often assume a cough like that is from a respiratory infection, allergies, or chronic obstructive lung disease. But when a cough is new or it worsens in parallel with shortness of breath or swelling, Consider the heart as a possible cause. A cough related to fluid in the lungs often has patterns. It may worsen when lying flat, or it may appear with exertion and ease with rest. Waking up suddenly at night, coughing or gasping, sometimes called paroxysmal nocturnal dyspnea, is a specific warning sign. Coughing up pink, foamy sputum is a more severe sign and requires immediate medical attention. Doctors will use physical exam findings, crackles heard in the lungs, chest x-rays and heart imaging to determine whether the cough is cardiac in origin. Treatments that reduce fluid in the body, including diuretics and heart medications, tend to reduce the cough if the heart is the cause. Again, do not assume the cough is only a lung issue. If it's new, persistent, or linked to other signs listed here, seek evaluation. For seniors who have both lung disease and heart disease, symptoms can overlap and complicate diagnosis. That makes it important to report any change in cough or breathing pattern promptly, because proper management depends on knowing the correct cause. Health organizations list cough with breathing difficulty as a symptom to track for heart failure. Number 5, faster or irregular heartbeat, palpitations, or lightheadedness. When the heart's pumping ability falls, the body often responds by changing heart rate and rhythm. Seniors may notice palpitations, a jumpy, fluttering, or racing feeling in the chest, or they may report feeling faint, dizzy, or unusually lightheaded. These sensations occur because the heart cannot maintain steady output, or because abnormal rhythms reduce blood flow to the brain and organs. Atrial fibrillation, an irregular, often rapid rhythm, is common in older people and raises the risk of both stroke and heart failure. In some cases, atrial fibrillation causes the first noticeable change, a fluttering chest or a skipped beat. Other arrhythmias can produce similar sensations. If a senior reports palpitations for the first time, or if palpitations come with weakness, fainting, chest pain, or worsening breathlessness, get medical help quickly. Healthcare providers can check the rhythm with a simple pulse exam, an EKG, electrocardiogram, or monitoring devices that record the heart rhythm over time. Some arrhythmias are intermittent and need longer monitoring to capture. Treatment may include medications, procedures to restore a normal rhythm, or devices to support the heart's pumping. In heart failure, controlling rhythm and rate often reduces symptoms and lowers risk. Never dismiss new palpitations or repeated lightheaded episodes. In older adults, these symptoms may indicate a heart rhythm problem that needs immediate testing and possibly urgent treatment. Number 6, reduced appetite, nausea, or unexplained weight loss or gain. Appetite changes are common in older adults and can signal many conditions, but when combined with other signs, they can point to heart trouble. When the heart fails, blood flow to the gut may fall and fluid can build up in the abdomen. Both effects reduce appetite and cause feelings of fullness or mild nausea after small meals. In other cases, rapid weight gain appears from fluid retention rather than increased calories. Conversely, unintentional weight loss can occur with chronic disease and worsening heart function. Track weight carefully. As noted earlier, a rapid gain of about 5 pounds in a few days is often fluid, not fat, and should trigger medical contact. On the other hand, steady weight loss with poor appetite and worsening tiredness warrants evaluation for multiple causes, including progressive heart failure, poor nutrition, or other illnesses. Number 7, increased need to urinate at night. Needing to get up at night to urinate, nocturia, becomes more common with age, but a sudden or large increase can signal fluid redistribution that happens in early heart failure. During the day, fluid may pool in the legs because of reduced forward pumping. At night, as the person lies down, that pooled fluid returns to the circulation and the kidneys filter more, causing more urine at night. If someone starts waking several times at night to urinate when they didn't before, and if that change comes with swelling, breathlessness, or weight gain, it often indicates fluid shifts related to declining heart function. This symptom is easy to miss because nocturia has many causes: prostate issues in men, bladder conditions in both sexes, sleep apnea, or medications. Still, Consider the whole picture. Increased nighttime urination plus new swelling or breathlessness suggests the heart is part of the problem. Mention this symptom to a clinician. It helps them decide which tests to run. Number 8, confusion, memory problems, or mental slowdown. Changes in thinking, confusion, or episodes of disorientation may be early and sometimes overlooked signs in older adults with heart problems. Reduced cardiac output can lower blood flow to the brain, and fluctuations in blood pressure or rhythm problems can cause brief confusion or fainting. Seniors might seem more forgetful, have trouble concentrating, or show mood changes. Family members sometimes treat this as normal aging, but a sudden or progressive change in mental function should trigger a medical check. Confusion can also stem from low oxygen levels, infections, medications, or metabolic imbalances, and these often interact with heart conditions. For example, fluid overload and poor cardiac output can lead to low oxygen and chemical shifts that worsen cognition. Doctors may order blood tests, imaging, and heart assessments to identify whether the heart is contributing. Number 9, chest pain, pressure, tightness, or new upper body discomfort. Chest pain or a new feeling of pressure in the chest is not always a heart attack, but when it appears in older adults, it must be treated as a serious signal. Seniors sometimes write off mild chest discomfort as indigestion, muscle strain, or a sign of being out of shape. That mistake can delay care. The heart and the blood vessels that feed it are a common source of chest symptoms. When the heart muscle does not get enough blood, it produces pain, pressure, squeezing, or a heavy feeling across the chest. That same lack of blood flow can also reduce the heart's pumping ability and lead to or worsen heart failure. Not every chest pain means the heart is failing, but chest pain that happens with shortness of breath, sweating, nausea, fainting, or sudden weakness needs immediate attention. Angina, stable or unstable, is pain caused by blocked blood flow to part of the heart. Unstable angina or a heart attack may present as sudden, severe chest pressure, pain spreading to the jaw, neck, arm, or back, or a new pattern of recurrent chest discomfort at rest or with minimal activity. Those are emergency signs. Even subtler patterns, a steady increase in chest tightness during ordinary tasks that used to feel easy, matter, especially when seen with the other signs already listed: breathlessness, swelling, fatigue. Rapid action reduces the chance of permanent damage to the heart muscle and lowers the risk of sudden deterioration. Chest discomfort in older people can take non-classic forms. Instead of a sharp stabbing pain, it may be a long, dull pressure. It may feel like indigestion or severe fullness. Women and seniors often describe cardiac pain in these atypical ways. That is why any new, unexplained chest sensation should prompt at least a phone call to a medical provider to decide whether an urgent evaluation is needed. Number 10, cold, pale, clammy, or bluish skin and weak pulses. Signs of poor circulation. When the heart can't pump enough blood, the body diverts flow away from the skin and extremities to preserve perfusion of vital organs. That process shows up as cool, pale, or even bluish, cyanotic, hands, feet, or lips. Arms and legs may feel cold to the touch. The skin may look pale or mottled, and capillary refill, the time it takes colour to return after pressing on a fingernail, may be delayed. Peripheral pulses can be weak or thready. Those findings point to reduced cardiac output or poor tissue perfusion, a more serious stage of heart compromise that needs rapid assessment. Call a clinician quickly if a senior develops persistent cold extremities, bluish lips, or unusually pale skin, together with dizziness, confusion, fainting, very low urine output, or very rapid breathing. Those are warning signs that circulation may be inadequate. In low output states, the body is not delivering oxygen and nutrients well enough to tissues. That raises the risk of organ dysfunction. Older adults who are already taking blood pressure or heart medicines must be particularly monitored because drugs can interact with low output to make perfusion worse. There are clear, observable clues caregivers can check at home. Compare both hands and both feet. Feel the temperature. Check pulses at the wrist and ankle. Look for bluish color around the lips or nail beds. Note whether the person is more sleepy or confused than usual. If pulses are faint and the person is sleepy, pale, or breathing quickly, this requires urgent medical evaluation. It may be progression toward cardiogenic shock or another critical state. Poor peripheral perfusion can come from causes other than heart failure, severe dehydration, major blood loss, or sepsis, for example. But in the context of the other heart signs we've discussed, it most often reflects failing cardiac output. Tests in the clinic: simple blood pressure and pulse checks, blood tests to look for tissue stress, and an ECG help sort causes. Imaging and invasive monitoring are used when the clinical picture suggests severe failure. Early detection of low perfusion lets teams adjust medications, support circulation, and sometimes prevent the need for intensive care. If you found this video helpful, make sure to give it a like and subscribe so you don't miss our upcoming health tips for seniors. Leave a comment below and tell us which of these signs you've noticed or want to learn more about. And before you go, check out the next video on your screen. It's all about the best vegetables to strengthen your heart and boost blood flow naturally. You won't want to miss it.